So how was your experience about all this situation, all the operations, before and after, if it's okay for your expectations? What do you want to tell or what do you want to ask about that? I'm curious about your experience. Tell me.
So I made the decision to have this surgery because I was starting a new life, and I had always wanted to do the breast lifting, and then you suggested that at the same time have the nose done, and so I just kind of left that up to you. You do what you want to do. I trusted you to make the right decision for that.
Thank you very much.
And so I wasn't really thinking about what would happen to my nose, but I'm really happy with what happened. It exceeded my expectations.
Great.
And,
this is just great.
So I'm really happy with how it's turned out, and I just enjoy looking at it. It's so nice.
Always have the mirror?
Yeah. So yeah, it's nice. I keep taking pictures, from the front, from the side, and
selfie.
So that's it, yeah. Especially just watching the progress. That's been kind of fun, and as the swelling goes down, it's nice. And
how about the other people?
Other people have noticed. I mean, they didn't notice initially. Like for the first month and a half, you couldn't really tell because of the swelling. And but then as the swelling went down further, it's been almost 2 months now. Now people are noticing, but they don't know what they noticed. They see some change, but they're like,
in a good way.
Yeah, they're like, there's something different about you. Yeah. And then I say, well, I had my nose done. Oh, or I say, well, I had my nose done. They're like, now I see. I was trying to figure out what was different about you. So so that's turned out really well. And I thank you for that.
You're welcome.
So glad you encouraged me to do that. I don't think I would have considered it otherwise. And as far as my breast lift, I was really happy with the results because I just hated the way they looked before. So I just love the fact that I can actually like what I see. Before I just was disgusted with what I saw. Yeah,
it wasn't that bad.
It was awful. I leaned over and it would just hang. It was gross. And so I'm really happy about that. It took me a while to, of course, at first after the surgery, I was kind of
depression.
Yes, I felt
it's very common.
Yes, I talked to a friend who had, and she told me that she felt the same. I'm like, did you regret doing it after the surgery? And she's like, yes. Yeah, and I had friends who tell me, oh, don't worry, it'll pass. Don't worry, it's going to get better. And I didn't really believe them. But then it did. It
did, yeah.
And I'm really glad that I did.
Always. It's 100%. You have the depression in the first day or first 3 days. Yeah. This is very common because you're not an ill person. Then we put you in the bed.
Yeah.
This is that's why.
Yeah, you're like, why did I do this to myself? I was healthy, I was fine, and here I am feeling miserable. And but there was no pain, involved with the parts that were cut, which is really interesting. It was just the general feeling after
tiredness.
Just this. I don't know. I just felt weird, and being bedridden or not being, or have your movements restricted. Is something that I had trouble adjusting to, but it got better and better, and
in time.
And I went back to work after a week, and it was
after a week.
Yeah,
perfect. Yeah.
And that was because I took my time. I could have probably gone back before that, but I just decided to take it easy. And then when I started, I was fine. I was doing my
going to your
stuff.
social life. Usually, it helps.
Yeah.
For healing, right?
Yeah. I started walking pretty soon after, like maybe 3 days, 4 days. I'm not sure.
You're doing exercise very often.
Yes.
Every day.
Every day.
So, how was it?
I
mean,
Before that, I was doing vigorous exercise. So I still haven't gotten back to doing at the level that I'm used to doing. But you can still do things to get that release, the energy release And so there are things that you can still do, like abs and squats and things like that.
True.
And I like the fact that you're sensitive to my needs as far as exercise. 'Cause some doctors are like, just don't do anything. Just wait 3 months, don't move, and then you can start, because they just want to take the safe side, you know. They just,
True.
you know.
True.
And so that was nice that you were understanding about my needs. my
I do exercise as well, but not as much as you do. So I understand.
yeah. It's like a need. It's like
it's needed.
It's a way to you know, feel happy.
Lifestyle. Your lifestyle.
Yeah,
also.
it's part of my life. Yeah, and it makes me happy. So I don't want that taken away from me. So that, that was good that I could do some things, you know, adapt to what I was, you know,
doing before.
Just follow the restrictions, but still adapt, you know, a program.
Perfect.
Yeah, according to the
Very
restrictions.
good.
So that was good.
Okay.
And so now I can start I will move, start a new job, and I'm all ready for that.
Great.
Yes.
You're ready?
Healed. Yes.
Perfect.
Almost completely.
Okay.
It was just my nose. I don't feel it like I feel a little sensitive around here.
Still
That's
swelling.
it. Yeah, there's
still swelling you have. Normally, in the 6 month, we say you can see the last result, 100%. The swelling is gone usually. For nose, it's 6 months or 1 year or 2 years. It depends on the thickness of the skin usually, and your skin is very thick actually, especially in the nose part. So you can see the last result, I think, like 1 or 2 years, and you can have the sensitivity actually for the the tip of the nose. Usually after, I had the same thing after 2 years maybe, but 6 months you can see the result usually. For the breast, also for any kind of surgery, we say 6 months. Yeah, if we do anything new for the same area, we say after 6 months we do the same. That's it. So 6 months.
So I'm headed for the beach, so I can go swimming in the beach.
Yes,
I mean,
for sure.
in the sea.
For sure, you're ready.
Yeah,
new
next
bikinis.
Week, yeah.
Yes,
next
why
week
not?
I'll be on the beach.
Honolulu.
Yeah.
Honolulu. How you spell it? I don't know. Honolulu.
Yeah.
Great.
So yeah,
I want to come with you.
Yes.
Bring me too.
Yeah, especially with this cold outside.
Yeah.
It's nice.
Okay. Anything else? Any question you have, or you have the all?
Yeah. So as far as going back into sports, like the same level as I was before.
Yeah. Just think about your body. Your body is usually guiding you. Your guide, the guide of your body. I mean, if you feel pain, just stop it. But if you don't feel any stretching, any pain or anything, you can go on it. Not rush. Just that's the only thing that I can tell you. The rest you can do anything. If you want to run, like you do as usual, you can use a very tight bra, the sports bra. So that just a little bit maybe, bouncing is okay, but just a little bit, not too much. That's it.
So bouncing is not good, but pressure is okay.
Pressure is okay. Pressure is very good actually,
Okay.
but not too much like the bras, like push-up bras. We don't like them because they make it like too much, so it can also sag afterwards.
Oh.
Yeah.
Okay.
So just don't have the push-ups, or just don't have the with the wires. The simple ones, you can use the ones with the lace, just lace. That's okay. Or if you do the sports, just use the very pressure.
I have some really tight sports bras. You just pull it over, and it just
exactly
pushes it
push
down. And
exactly.
That's okay.
That's it. Yeah.
And that's not going to hurt the stitches.
Exactly.
To push it down.
Yeah.
Okay.
For the scars, actually, also.
Oh, okay.
You will use for the scar healing.
The gel.
The gel, yeah. That's it. And for 3 months of using, it's also usually it's enough. That's it. And your scars is already very nice, so it will be okay.
There's like I just remember there's like one stitch that's still there. I can see it black.
It's
that falls
okay.
out?
Yeah.
Or it comes out on its own? Or what is it?
These
The
are
body
all
just kind of pushes it out?
absorbable. Yeah, they are all absorbable
okay.
stitches, so it's okay.
Okay.
It will go by its way.
Okay.
That's it.
And one on each side, I think.
Yeah. Yeah, this is the key suture usually, very strong one.
Oh, that's the one. Yeah. Okay, maybe that's why.
Yeah, that's why.
Holds
It's
on
better
till the
to
end.
exactly. It's better to keep it.
Okay.
Okay, that's it.
Okay. Well, thank you.
Okay, you're welcome.